reach out to myself, or Joylene Carter is here to support you as well. All right. Thank you all so much for being here. We had about 100 people registered for today, so I imagine we'll have more people trickling in, but I do want to go ahead and get started as we have a lot of really great information to provide to you all today. First, just want to get some introductions going. My name is Christy Hudson. I use she, her pronouns. I'm Transformation Manager for the System of Care Advisory Council. Want to offer an opportunity for everyone here to introduce yourself in the chat with your name, your pronouns, maybe what part of the state you're joining us from, or anything else that you want to share about why you're here today. It would be great to know a little bit about you. I also want to take a few minutes to introduce just a few people that you'll be running into during this party today. We've got a number of folks who are participating and joining as facilitators, starting with Anna Williams, Executive Director of the System of Care Advisory Council. Dan Toma is also with us. He's a member of the SOCAC representing insurance providers. We also have Cody Welty and Joylene Carter with us. Cody's a research analyst in service to the System of Care Advisory Council, and Joylene is our family engagement strategist. For youth and family advocates specifically who are attending today, if you need support or help or have a question, Joylene is here to support you, so you can chat her, you can send her a text message. Joylene will also be staying back in the main room throughout our event today, so really available if you need help in any way. I also want to take this opportunity to share my enormous gratitude for the OHSU data team. You all have been incredible partners over the past year and a half that we've been working on this data assessment. I feel like this event is a real celebration of our partnership and the great work that we've been able to do in partnership with you. So really big thanks and gratitude to Dr. Becky Marshall, Julie Majors, Masuma Musavi, and Amanda Rivers, all colleagues from the OHSU Data Evaluation and Technical Assistance team. Thank you all so much. It's been really, really enjoyable to work with you on this project. Right. So just to get us a little bit warmed up, because we're hoping this will be an interactive and fun party, we have a few Zoom questions for you to get a sense of who's in the room. So you should be looking at 3 questions that we invite you all to answer. Who or what do you represent today in this party? Where do you live? And why did you show up today? So we'll give everyone a minute or 2 to respond, and then we'll look at the results together. All right, just maybe 10 more seconds, and then we'll close the poll. All right, hope you had a chance to respond. Let's take a look at the results. So looks like about half of us are representing a system partner. Quarter of folks are representing a family member or caregiver with lived experience. Another fifth, about 22%, are youth. Thank you all so much for being here. It's great to have you with us. In terms of where people live, Looks like about a third, slightly more than a third, live in the Portland metro area, about half from the corridors. That seems about true with demographics in the state, but representation from every region. So that's wonderful. And why did you show up today? 65% of people are here because you want to make data-driven decisions about the system of care. Love to see that. And 16%, five of you self-identified data nerds. That is wonderful to see too. And 13%, not totally sure why you're here. Just sounded interesting. It's great. Really glad to have you all here. All right. So today's goals, why we are here and what we're hoping we will achieve together over the next couple of hours is to first learn about the System of Care Advisory Council's strategic planning efforts. You'll hear a little bit about that on the next slide. Two, to understand the scope and process of the data assessment. OHSU put together a really incredible resource that we recently published. We're going to dig into the details and just a little bit of the data that's in that report and start to hear your reactions and your thoughts about it. That is kind of the bulk of why we're here today. Third, we want to explore trends and insights about that data with you all. And four, we really hope that we'll have some meaningful discussion. The bulk of the next 2 hours are going to be spent in breakout rooms and allowing you to kind of bounce around to different topic areas that you might find of interest. And so again, really hope that you'll engage in some conversation and sharing with us about this really important data. Before I go over that, well, first, some housekeeping. Again, please stay muted unless you're in a breakout room, but definitely encourage chats and reactions. I see lots of people contributing in the chat. That's great. Please keep it up. We are recording this event, and that will be posted publicly to the System of Care Advisory Council's YouTube channel after today for sharing and viewing by others who aren't able to be here today. Closed captioning is available. And again, we also have live Spanish interpretation. So if you have just joined us and not yet selected a channel, we instruct you to do that so that interpretation works correctly. From your menu, you can click on interpretation and either select the Spanish channel or the English channel. We also want to invite you to utilize our group agreements today in our conversation. So first, we ask that everyone be present, participate, and listen actively. We ask that you respect others when they speak and avoid interrupting. We're going to try real hard to avoid acronyms. We're probably going to mess up on that one, so hopefully we can all help each other with acronyms and call that out in the chat. We ask that you challenge ideas and not people. Use the names and pronouns that people introduce themselves with. We ask that you honor those with quieter voices and lean in or lean back if you're speaking more than others. We ask that you avoid problem solving for individual situations. We know that a lot of you are coming here with very real and lived experience in these systems. Our focus really today is about improving the system of care in Oregon. So let's stay focused on that purpose. And finally, we ask that you be mindful of power dynamics in the room. This is in particular for those who are representing systems or state agencies today. Please be mindful of what you bring into the various spaces that you'll be joining. All right. So if you have not been a part of System of Care Advisory Council meeting or committee or never heard of this, just a little bit about what the System of Care Advisory Council is. It is a group of 25 people who are appointed by the governor to represent youth, families, state agencies, tribes, insurance providers, and service providers. So 25 people, very passionate. And this group of individuals is charged with developing recommendations for the youth system of care. The council was originally established in 2019, and since then has been developing policy recommendations, strategy recommendations, a strategic plan, all with the aim of improving the effectiveness of youth serving state agencies and the care that youth and their families receive. System of care is both a philosophy and a structure to improve services and supports for young people or those aged 0 to 25 who have complex needs related to mental health, substance use disorder or addiction, intellectual and developmental disabilities, trauma, or co-occurring conditions. System of care aims to expand prevention and early intervention services and trying to interrupt and dismantle involvement with systems like child welfare and the juvenile legal system. We prioritize youth and family centered decision making, the delivery of home and community-based services, and the provision of culturally and linguistically responsive services. So that's a little bit about the council. One of our primary requirements in the legislation that created a council is that we need to develop a strategic plan for the system of care. So every 4 years, we, in partnership with partners and youth and family, develop a plan that provides recommendations related to things like needed services and supports, ways that we can reduce the risk of involvement with the juvenile justice or legal system, recommendations related to the system of care governance structure. It states our core values and guiding principles, as well as standards related to the provision of culturally responsive and linguistically responsive care. The first strategic plan was first published in 2021, outlines the work that we need to take through the end of this year. Our next plan is due January of 2026. So the System of Care Advisory Council is very busy developing that next plan. That is a big reason why we are here today, is to start look at the data and start thinking about the data and the things that we need to do to improve the system. So we'll be talking a little bit about other ways that we hope you will all engage in our strategic planning process. But that is a little bit of why we are here today, and we are all trying to move towards a vision. The vision you see here is the way it was written in our current plan. This is subject to change for the next plan, but despite the words that we land on in the next plan, I think the spirit of this work will remain true. Really trying to get to a future where young people from all backgrounds are healthy, safe, learning and thriving at home and in their communities. So thank you all for being here. I'm going to now turn it over to Becky, I believe, from OHSU's data team, who's going to start digging into a little bit more about the data assessment report.
Hi, everyone. So Christy sent out, in the email that Christy sent out earlier this week, there is a link to the full data report. It's very long. Everyone may not want to comb it from cover to cover. And so really this data party is to provide some highlights of the data report. And I'm going to tell you a little bit about how we developed the report and how it's organized. And then we'll go into more detail during this presentation. But if you do want more details, the link to the report was posted by Masuma in the chat a few minutes ago, and it's also in the email that Christy sent. So to do the strategic planning process that SOCAC is mandated to do, they very appropriately wanted to collect a lot of data to guide the strategic planning. And so a little over a year ago, SOCAC partnered with my team, the data team at OHSU, to pull together data from a number of different sources. We ended up with over 400 to answer some really important questions about the system of care. These included who's being served by the system of care and who's not being served, what's working and what is not working in the system of care, and what resources are being allocated to system of care work. In total, we ended up coming up with about 70 different questions that were really important to guide the strategic plan. So the data team, in answering these questions, we gathered together data covering the years 2020 to 2023. We pulled it together in this report, and we worked really closely with the SOCAC Data Committee, with the overall SOCAC Council, with representatives of the different system of care agencies, and with youth and families to both guide the questions that we asked and then to review the report once we started to pull together some answers. So like Christy said, we just recently published the whole report. It came out in early 2025. And we focused in the report on 12 content areas, which are listed here on the right hand of the screen. I'm just going to read them so that you kind of get a scale of the scope. So we started with a population overview, which describes the population that is served by the system of care in Oregon. A section on on neighborhood and community in Oregon, on the education system, the physical healthcare system, the behavioral healthcare system, intellectual and developmental disability system, child welfare system, the juvenile justice system, the system workforce, system funding, youth and family experience of the system, and then a final section on the system's readiness to change. So really important kind of organizational categories that answer these 70 questions that we were tasked with answering. So today, we're going to be focusing on just a few of these categories. And Amanda is going to describe how we're going to proceed through the presentation today. Oh, Julie, sorry. Julie's next.
Okay, so on this slide, we just wanted to kind of orient you if you're not really familiar with or commonly working with data. We don't want the data to be intimidating or even the concept of data. So think about the data as information that is describing what's happening. So in trying to answer these 70 questions, we looked at what data was available to give us some answers. So as we're moving through the slides in the breakout rooms, we're going to want you to imagine that you're at a conference, maybe you're walking around an exhibit or a poster session, and you're just talking to people who are standing next to their poster, and you're looking at it and you're thinking about what's on the slide, what's catching your interest, and what would you like to say about it? What kind of ideas is it conjuring for you that you would like to share? And so we're hoping, even though this is a pretty big and overwhelming body of data, we're hoping that we're able to have a conversation about it in a meaningful way.
So, I am going to go over the logistics of how the next hour is going to work. So as Julie mentioned, we're really trying to mimic the experience of like walking around a conference hall where you're visiting a board, having a conversation with the person next to the board, and just kind of spending some time getting familiar with the content at your own pace. And so to do this, we're going to do 4 10-minute breakout rounds. And you're going to choose 4 of the 7 breakout rooms to visit during, or one of the 7 during each session. And so we have 7 rooms that each cover a certain chapter. I'll show you the list in a few slides. And there will also be a room dedicated to our Spanish speaking guests. And so this room will have all 7 topics and an interpreter and a moderator in that room. And so since there are 4 sessions, you'll need to choose 4 out of the 7 topics that you're most interested in. And once you're in the room, there will be just 1 slide with information available. So again, you'll kind of take it in as if you were looking at like a poster, take it in at your own pace. And then when you're ready, there's a moderator in the room to answer questions or just kind of facilitate a group discussion. So once we're in the breakout rooms, we really encourage you guys to come off mute and have a discussion. Otherwise, the chat will still be available if you'd rather share in the chat. And then at the end of the 10 minutes, you'll be brought back into the main room and you'll repeat it. So you'll choose a different breakout room to visit for the next 10 minutes, come back and repeat. Joylene is going to be in the main room, so she can kind of help you navigate if you're having trouble, help with any tech issues that arise. But we thought we would do a practice round before sending people off. And this is an important topic that we think is good context for everybody to have. So we're going to practice with the population overview. So this is an example of what your breakout room will have. This particular one, the population overview, is just a look at the overall population that we were studying in this assessment. And so I'll just give everyone a couple kind of quiet moments to absorb the information. And when you're ready to kind of add thoughts, reactions, ask questions. Since we're in the big room with everybody, we'll just leave it in the chat. So if you guys can add it to the chat, that would be helpful. But again, in the breakout rooms with smaller groups, we can have an actual live discussion. So I'll give everyone a couple minutes. Thanks, Cody. Always good at kicking off the chatting. So where can I find more information about the specifics for these numbers, like how much higher the rates of substance use may be than the national average? So when you're in your breakout room, your moderator might be able to answer some of those questions. We have the report pulled up so we can kind of reference back and forth and get you specific numbers. So feel free to ask, and if we can't get it in the moment, we'll definitely direct you where. But otherwise, all of the actual data is in the report that Masuma linked earlier in the chat. Thanks, Cody. Overrepresented. So that is a good question. What does overrepresented mean? And if you look at this table at the bottom, this is a good example. So when we talk about overrepresentation, we're saying that based on the population, this group is showing up more than we would expect them to. And so it's not saying that there, for example, are more Black and African American youth in child welfare than white youth. What we're saying is that this 4.7% of Black and African American youth who are in child welfare is more than how much they make up in the general youth population in Oregon. So that's what we mean when we're talking about overrepresentation. Other kind of thoughts you might have that you might want to share to the chat. What are your kind of just general reactions? Is anything surprising? Does it feel in line with your experience, or are you surprised by any of these kind of takeaways? And what other questions does it bring up for you? I see a question of why the stats don't show other nationalities. This is again in the report, we have the full kind of big table with all of the demographic information for each system. And so for this, we're just showing kind of like the big key takeaways of like what kind of trends stood out to us.
So, Amanda, is it accurate to say that Black and African American youth and American Indian and Alaskan Native youth are the most overrepresented across the systems? Is that why you pulled them out?
I believe so, yes.
Thanks. And there's some other questions in the chat. I don't know if you want to dig into those.
Yes. Sorry, I'm a slow reader. Do you know if number of youth in any system is decreasing or only number of youth involved in multiple systems? Christy, do you know that off the top of your head so I won't make everyone sit here while I reference the report?
Yeah, I can try. So this data comes from the System of Care Data Dashboard, which is maybe another interesting website that we want to put in the chat. Um, that data trends all the way back to 2020. And so if we look at 2020 to end of 24, which is what we have the most data for, overall, young people are there's an increase in the behavioral health and intellectual and developmental disability services. More youth are accessing those services. Child welfare has been on a pretty significant decline since 2020. The juvenile justice system, while it saw a little bit of a decline, mostly during COVID, has been kind of trending upwards since like 2022. So that one is a little bit kind of stable. So that's why we said that the overall decline here really seems to be driven by less young people involved in child welfare.
Let me see some of these other questions. Thank you, Christy. Okay. I think with Sarah's question, what factors do you think are driving these higher rates of substance use and mental health and suicide death? I think that would be like a great example of a question for like the group to discuss in a breakout room. I don't know if I want to try and take a stab at that, but I don't know if any of my other colleagues would like to.
Very quickly. It's pretty consistent.
Cody, it's hard to hear. Can you lean into your microphone?
No. Let me try to fix it first.
Okay.
I'll put it in the chat.
Okay. And then while Cody is putting it in the chat, I see Alicia's question, is this only based on race, or does this account for children, youth with disabilities regardless of race? If I am understanding your question correctly, I'm guessing you're talking about this bottom table. And this is just race and ethnicity data from the census. So it's just the general population and from the System of Care dashboard. So again, any system involved youth, regardless of disability status. Okay.
Can I clarify my question? Because it was
Sure.
yeah, so my question was in regards to the discussion around overrepresentation
Mm-hmm.
when we were discussing earlier as to why, because there was a question earlier as to why those two populations were pulled out. And the answer to that was something along the lines of, because those were the two populations with like the highest overrepresentation system. And my question was regarding that piece. Is that are we like, does that account for kids with disabilities or kids and youth with
I see.
or are we just looking at the race part and in the racial aspect being overrepresentation?
I see. Sorry, totally misunderstood that, I think, because I read it so much later. So in the report, in like the demographics table where we talk about over and under representation, I believe the only indicators in there that we could consistently find United States Census, Oregon Census, and each system census is age, gender, and race and ethnicity. When there was like data by disability for a system, that will likely be in the system chapter. So, like, for example, I'm facilitating the juvenile justice one today, and we have comments or we have some data about how I feel like I'm going to say it backwards, but male youth in the juvenile justice system are more likely to have a disability than there's a disability. I'm going to say it backwards, so I'm going to just save it until I'm in my breakout room. But yes, so those might be kind of sprinkled throughout the chapter, but we weren't able to find like a solid comparison for like United States rates, and so it's not in this census section. Okay. All right. Before I continue, are there any other comments from any of my co-facilitators before I kind of move in and let people dive into the topics that they're most interested in?
Just that I think this was a great practice. Like
Yes.
exactly the type of conversation and questions and intrigue and curiosity that people will bring into these other chapters. So great work, everybody. A plus.
Yeah, and just one more point, again, for people like myself who are not accustomed to like working with the data very much, but I'm very interested in the data. I think what we're going to find is a lot of questions do get generated. Some we will have answers and explanations based on what we what was done and reported in this document. But just as a note, remember that each slide represents a single chapter in the report, and that the chapter itself has so much more information and context. The slides are trying to pull some highlights or some patterns out, and it will be really helpful if you open the report and have that report available, because each moderator might have to like reference into the report to try and answer questions, and maybe we can look at it together in each of our rooms.
Julie. Okay. All right.
And Amanda, Bree has a question.
Oh, thank you. Sorry, I have a lot of windows open. Feel free to unmute.
Are the numbers the same or comparable for the numbers of substance use and mental health disorders?
I think, Becky, were you responding to that in the chat, maybe? I think I saw that question.
I was responding to the question about suicide rates.
Okay. Can you say more about your question? Which numbers are you asking are comparable to the numbers of substance use and mental health disorders? I'll go back to that.
On the slide it said that Oregon youth have higher rates of substance use and mental health disorders than the national average. And I was just wondering if those numbers are comparable to each other.
Oh,
if
interesting.
they're around the same height.
I'm not sure. I can look and see if I can find that because off the top of my head, I'm not sure. I would guess that mental health would probably be more prevalent than substance use, but I might be misspeaking. Christy's saying yes, though.
Yes, I think so. And Abri, I can get the page number for you where I think that data is located.
Okay, thank you very much.
You're so welcome.
Thank you.
Thank you all so much for hanging out and staying with us. It really warms my heart. We've got 38 people at 5:30 on a beautiful Thursday afternoon who are just nerding out on data with us. So thank you so much. We're gonna just take a few minutes now to hear a little bit about the discussion that happened in all of the breakout rooms. So just I'll ask each moderator to share just a few key highlights from your room. Where do we want to start? Anna, do you want to start? I think you were in the education room.
Sure. So In our first breakout room, we talked a lot about the expulsion rates and kind of considering whether so there's a statistic on the slide that says Oregon has lower rates of suspension, expulsion, and dropout than the national average. And so we were discussing like why that might be, what that might mean. Is that about the students? Is that about the teachers? Is that a policy thing? So we're kind of digging in a little bit on that. And that, comparing that information year over year rather than to the national average might be more meaningful. Because it may be that we're comparing apples to oranges or something, right? That we've defined suspension, expulsion, and dropout in a different way than the way that the national numbers are being counted. Um, and then in the second breakout room, we had conversations about IEP access and school push out and how that data is collected and what it means, like kind of a quiet push out that maybe isn't reflected in the information that we have on the slide. And some disappointment around the missing information on the slide around demographic details for both intellectual developmental disability diagnoses as well as racial information around school pushouts. And some questions around why we're not measuring how safe people feel at school until they get to grade 6. And then in our final group, we had some really interesting conversations about foster students and their different experiences in schools and how we might be better able to support them and some promising practices that are happening. Really, really great conversations. Thanks, everybody.
Thank you, Anna. All right, let's go to Dan, who I think was in the neighborhood and community room.
That's correct. We also had 3 good conversations. A number of questions came up that I wasn't able to answer. Some of it related to why is Oregon a child care desert? The ages of parents or the ages of the kids for parents who are responding to some of these questions. A couple of additional questions. Also, there was a point made that what we're looking at, neighborhood and community, is really, and I'll quote, as upstream as it gets, and that it's this piece can sort of not sometimes get the attention that it deserves because there's not an agency devoted to it. And it's not like addressing a specific focused problem. And there's a hope that we will really take the time to look at this, look at these issues of neighborhood community, social determinants of health, and the stressors that parents and families face in the planning process. I guess the last point that I would point out is the risk that the way that social isolation and lack of respite care can increase a family's risk. And that, so again, that points again to this really being an upstream factor that we would do well to address.
Thank you so much, Dan. As a public health person, I really appreciate the call out to there not being a single state agency that's responsible for all those things, yet how important they all are to the outcomes everyone is trying to get at. So really appreciate that. Let's keep it upstream. How about Masuma, who's facilitating physical health breakout room?
Yeah, so we talked about, similar to what Dan said, that there's no centralized agency for physical health. So it's kind of hard to compare across different hospital systems, different primary care settings. And then we also talked about why prenatal and postpartum care is important in a youth's lives and how that carries over through life. We talked about well child visits. And then for prenatal and postpartum care, we talked about disparities related to different race and ethnicity groups. And then we talked about health screenings in primary care settings, what those different health screenings mean, and how many people were actually treated according to testing positive on, for example, like a depression screening. One thing that did come up was a good question for a future assessment. What people were wondering why sexual health screenings weren't included in primary care. And I was like, that is a great question. So maybe that's a great question for a future assessment to include, because I agree that is very important.
So interesting, Masuma. Thank you for bringing that up. Yeah, we don't really talk a lot about sexual health in this context. Really interesting observation. Thank you for bringing that up. How about behavioral health? Becky, I think you were moderating that room.
Yeah. We had some interesting discussions. Each breakout session was really different. We started out by talking about what Dan and Anna were talking about a bit, which is really the importance of measuring prevention and upstream services. And someone pointed out a really interesting point, which is that the amount of data that we included in this report on crisis-oriented systems really reflects the system itself, that we don't have enough upstream kind of services for families and youth when they need it. And so we talked about just the difficulty of measuring need and availability and how important that is. And then there were a lot of questions about the survey data, why we didn't have better youth survey data, about experiences, satisfaction, availability. And then we talked about some discordance between some of the parent satisfaction data that we have, like there's some statewide data, and then there was some CCO data, and the satisfaction rates didn't really match. And so I think there was some concern about what that meant, and just in terms of like what we're actually measuring. And then there was some discussion about the difference between behavioral and mental health services, and I think some frustration that we didn't do a better job of breaking those categories down better in the report, and the importance of being able to better measure what actual services are being provided and paid for. And that's something that I think our state doesn't do very well, and that was really reflected in this report. And then finally, this really important question that has come up in all of the chapters in the report, which is getting at complexity, that it's really very unsatisfying to look at the data and not be able to see the complexity of youth who are in different systems or who have complex identities. And that is something that I think needs to be a priority for the state and for our next round of reporting.
Yeah, that's such a great point, Becky. Like, what does that even mean, right? We say complexity a lot, but does that mean like severity of a specific thing? Does that mean like co-occurring things? Like, how do we define that?
Yeah, and all of the above really is the message, right? Like we can't just clump all of our youth into one category. We need to really look at the differences and kind of specificity there.
Yeah, that's great. Thank you so much, Becky. I want to make sure we've got room for report outs and all the spaces. How about we move to Julie, who was rating intellectual and developmental disabilities.
Thanks for that segue too, Becky. The complexity question really came up in our group as well, in really all three sessions when we were talking about like the aggregate or the overall data of everybody. It didn't really seem to be reflective of what is happening in some of the parent support groups, that some of the data is reported as being higher. So for example, 78% of youth who receive services in home from the personal support workers, it was reported that they always are usually able to communicate with the child, and we really couldn't distinguish between in that within that workforce who might already be familiar with the child, who is already in that child's life, and is are the, it would be likely that they would have a higher success rate at communicating with the child if they're a DSP worker who's familiar with the child than if it's somebody from an agency that's hired to go into the home. And it's just not reflective of what some of our parents in the who are going to parent support work groups are reflecting. Also, the looking at the very low rate of children getting their behavioral health mental health support from a therapist or group counseling when needed. That seemed very low and something for the state to work on. And then again, just a lot of, an inability to really look at, thanks, Joylene, and PSW, personal support worker, being able to look at the context of the data, because there were so many different data sources that sometimes data from one source was not really lined up, reporting the exact same thing as data from another source. So we had actually referenced, because we were talking about these worker types, we had pulled up the report and we went down into the workforce chapter to look within that. And so recognizing that this data kind of feeds around throughout the report on itself to inform maybe some of the things we don't know or need to know more deeply. And then one of our participants mentioned that she had read the report forwards and backwards because she's had some time on her hands, and the limitations section is really very informative to recognize what is this data what's the data able to tell us currently in this in the current day, and what might we need to look at more closely.
Yeah, great share out, Julie. Thank you so much. Yeah, there's a lot of data here, folks, and we did not have time to even, we just skimmed the surface. And so to Julie's point, if you had questions you didn't see addressed, encourage you to look not only at the chapter where you were in the room for, but there's a workforce chapter, there's a funding chapter, there's a whole chapter on youth and family experience. There's a chapter about the infrastructure of system of care. So really encourage you to go back to the chapters that are of interest to you. Okay, before I turn it over to Cody and Amanda, I'm going to jump in and share a little bit about the Spanish breakout room, if that's okay. It was great because we had the same group of people the whole time. So we got into some really nice and rich conversations. Just a couple of highlights. We had a great discussion and curiosity about why do we have such high rates of mental health and substance use among youth in Oregon, and why is that so much greater compared to the rest of the country. So we had some conversation about things like, long-term impacts of COVID, concerns about social media and the impact it's having on young people. Conversations about the impact of the weather and the fact that it's kind of dreary here for a good part of the state, and how much different people might feel in the summer versus in the wintertime. So I thought that was really interesting. A lot of concerns about substance use in particular was the primary concern in our group. We also talked about education and the education space, and why the sense of safety or belonging tends to decrease as people get older and move through school. Curiosity about bullying and peer pressure. Again, we didn't get into that data, but that is captured in the report. And particularly the impacts for how they might be different for young people who are not from this country, not from the state, And so some curiosity about getting into some of the disaggregated data about the educational outcomes. So that was a little bit about what happened in the Spanish speaking room. How about we move to Cody, who I think you were moderating child welfare data.
I was. So we had a couple pretty small groups, and then we had a slightly larger group for the last session. Some of the feedback that we got was that there was a statistic in there that Oregon has less placement stability than the national standard, and so kiddos are moving around more often than recommended. And some of our folks with lived experience echoed that and agreed with the finding there. There were also questions about what makes Oregon's definitions for higher rates of referrals in investigations in family abuse, what makes our definitions different than the rest of the country, and if there was more information on how to actually compare those. And then we also had a really good discussion on why we think some of the youth and family experiences of majority of folks in the survey responding that they got the help they needed from the system, but also that there were a lot of folks that had traumatic and difficult experiences in child welfare, and why we kind of thought that happened. Some of the conclusions we landed on was that a lot of it has to do with the individual caseworker and the interaction with that touch point in the system. We also had a couple ideas for solutions, which are like more training and investment in social work, even though it's difficult and really challenging, and also some more like physical outreach and school assemblies and focus on our youth instead of only focusing on parents.
Thanks so much, Cody. Last but not least, Amanda, who was moderating juvenile justice data.
Yes, we, like others, had good and different discussions in each room, which was fun. To start, there was frustration and the lack of disaggregation in the report, and a feeling that this lack of disaggregation erases certain groups' experiences. So this was primarily in relation to the mismatch between per capita county representation and then the separate racial representation and wanting more intersectionality of that data. That came up again later in just wanting more cross-sectional or intersectional data to have more meaningful information. And so we talked a little bit about the limitations of the report and how we want to advocate for better data systems that can talk to each other within and across Oregon systems and to other state systems. We also talked about the home environment and had some great lived experience perspective. We talked about the importance of the youth voice being heard when discussions about living situations are being considered, the role that child welfare has in intervening in these living situations, and that they can sometimes fall flat, and reconsidering the idea that discharging home is an ideal outcome in all situations. And so we talked a lot about that. And the last thing was discussing why Oregon might have higher commitment rates. And so we talked about a few systemic factors that might be going on, and then a lot about upstream lack of intervention, especially for substance use, given the really high rates of substance use, specifically for OIA youth, Oregon Youth Authority, and how SOCAC and other committees can take this information and think creatively about action and interventions that can be put in place.
Great, Amanda. Thank you. You set up such a great segue on like next steps
What next?
and way to
Let me
continue the
share.
conversation. As you do that, I just want to open it up. We've just got a couple of minutes, but if there's anybody else, any attendees that just wanted to chime in with a burning comment or feedback, now's your time.
I I suppose for me, and I'm going through all the breakouts and seeing all the data, there is there's a youth focus without youth involvement a lot of the time. And I know part of the issue is like it's for youth that are under 18, like there's legal issues around getting data from them and stuff like that. But for me, it's like youth aren't just under 18, and there's also ways to collect data in a way that is reasonable. It feels like a lot of the data um, focuses on like from a system point of view and from a parent point of view without actually coming from a youth point of view. And that doesn't upset me. But that was the biggest thing um, that I noticed when looking at all the data.
Yeah, great call out, Saphir. I hear you 100%, right? Like a lot of this data isn't really, it's not what youth would probably ask other youth. It's not, there's just a lot of there's a lot missing there. I want to put a pin in that one in terms of thinking about strategic planning and ensuring that we make plans to do that better in the future, right? We're not going to fully understand these issues unless we're asking and involving youth in the beginning about this data and what it means and how it's collected and how it's interpreted and all of that. Abri, see your hand up.
Hello. I just wanted to say I've learned so much, and I appreciate the opportunity to be able to keep coming to these meetings and learning so much with you guys. It's really been a huge opportunity for me, and just very eye-opening to the data, that we've been going over. It's amazing.
Thank you. Thank you, Abri. I really appreciate that feedback. This was like a first go, y'all, and like I think it went okay. We have a survey for you. We love your feedback, but thank you so much for like your patience and your grace and hanging in with us today. It sounds like at least from Abri's perspective, we accomplished what we were hoping to do. So, thank you all so much. So it feels like there was a lot of rich discussion. People were starting to think about ideas and ways to take action with this data. And so just want to put in a big plug that we all really hope and want you and need you to be involved in strategic planning moving forward. So we are moving towards a final plan by the end of the year, and there's lots of ways that you can stay involved in this work. We are hosting action parties for youth and families, family caregivers with lived experience. Specifically, those are happening in a few weeks. The next slide has information about that. If you haven't already, can you go back a second, Amanda? If you haven't already, we have a listserv. We just put out like 4 times a year. It's another great way just to stay informed and kind of follow along with what's happening with our strategic planning process. So encourage you to sign up for that if you haven't already. I think Amanda will be dropping some links in the chat. System of Care Advisory Council meetings are all open to the public. We run a ton of meetings and subcommittees and work groups, and we love having people from the public in those spaces joining in conversation. All of the meeting links, the dates, the times, the agendas are all on our website. So please, if you want to get more involved in the work that we're doing at the state level, we have space for you. There's also really incredible work happening in local systems of care. So regional systems of care exist in every corner of the state. And so if you are curious about what's happening in your particular town or in your county, there's also work there that we can help you get connected to. Again, there's a website. Go check that out. If you have any questions, please do reach out. All right, I mentioned 2 action parties. So next month, or I guess it is this month, Friday, May 16th, we're having a party for youth with lived experience, and May 21st for family members or caregivers with lived experience. This is a space specifically to hear actions, ideas, solutions, strategies, things that will make the system better. That is the place where we want to hear those ideas. So if you are available and want to come, please do. We will provide compensation for you to be there, and any support that is needed. We really would love to have you there. There are some registration links that will be in the chat. We'll also send those out in a follow-up email. It's helpful for us to know you're coming so we can prepare and make sure we're setting up accommodations and all of those things. So thank you for the heads up that you want to come. Those are not in person. Those are all virtual.